We're here at the 2016 American Society of Hematology Conference in San Diego, California, and joining me is Dr. Tom LeBlanc. Tom, good to see you.
It's great to be here. Thank
so you are from the Duke Cancer Institute, and you're here to present an abstract this evening. Tell us a little bit about what you're going to present and what some of your work has been to date.
I'm happy to. So we've been studying the experience of patients facing a diagnosis of acute myeloid leukemia, or as we usually call it, AML. And in this particular study, basically what we did was enrolled patients who were starting a new treatment for their AML. Mostly these were patients getting more intensive chemotherapies in the hospital rather than in the clinics. And we asked them various kinds of survey questions about their symptoms, their quality of life, their distress levels, but then we also assessed their understanding of illness. Did they expect that they would be cured from this disease with the treatment they were receiving? What did they think their prognosis might be overall? And we did that repeatedly over time, weekly in the hospital, and then monthly when they were in the clinics and at home and outside of the hospital.
So you're asking them that question, those set of questions at diagnosis, and then as they're going through treatment, you're re-asking them those questions.
Exactly.
And what did you find? Give me the high level. Was there a large difference from when they were first diagnosed and asked the set of questions to as they progressed through the journey and their treatment protocol? Did those answers seem to change?
Yeah, so that's really the important question, and I will tell you we are doing a lot of different analyses. So what I'm focusing on with the presentation this evening is around issues of emotional well-being and understanding of illness, understanding of prognosis. So we will be publishing some of the other data a little bit later on and are working on those analyses, looking at symptoms and quality of life and how those change over time with treatment. But what I can say about emotional well-being and understanding of prognosis is that really we had two important findings that we'll be talking about later tonight. The first is that patients with AML appear to really overestimate their prognosis. In other words, most patients rated their likelihood of cure as being 75% or greater than 90%. And in this sample of patients, we unfortunately had a lot of folks who had more difficult to treat disease where their doctors would tell us that they unfortunately expect things probably aren't as likely to go that well. So that's a really concerning problem. The other issue that we found is that overall there seems to be a relationship between emotional well-being and understanding of prognosis. And to be more specific about it, ultimately we found that patients who have better emotional well-being scores on these standard instruments were also more likely to have a kind of unrealistic sense of maybe how they were likely to do in the future. So it's a bit worrisome. You might sum it up as sort of the catchphrase of having one's head in the sand a bit about what's going on, and it has a lot of implications probably for how we care for patients and families and how we communicate difficult news about a prognosis, for example.